I hear you. Ah, there you
You want
go.
me to, you want to make me co-host again so I can?
That's what I'm fumbling with my fingers. Hold on.
I just checked the weather for Vail next week. It's gonna be cold.
Yay. I'm so excited.
Ew.
Wait, how do we do? Okay, this isn't working for me. Okay, go to the participants, right? More. Okay, there we go. Make a host. You are a host with the most. All right, I am
Host with the most.
phone on airplane mode. What'd you say?
A host with the most.
Exactly. All right, airplane.
Oh, I don't want to be in the gym right now. Hold on.
Oh, funny. The good old days.
We'll be in the room. This room.
All right, let's talk when we're done. Also, I want to give you an update. Today is Wednesday. Okay, so you're on your own tomorrow, and yeah, if you have time to chat afterwards, that'd be awesome. I gotta fill you in. I like your shirt.
Thank you. I'm very pink for my white background.
Looks good. I'm very gray. It's kind of drab, but
Okay, so you ready to rock and roll and go live?
yeah, that's better.
Screaming.
And it's so yucky out. Are you guys getting hit by hurricanes?
No, we're on the East Coast. That's the Panhandle.
Oh, okay. We're live. Can we talk?
We are streaming live, my friends. Streaming live. I'm loud?
No, I said I can talk now.
Oh, yeah.
Good morning, good afternoon, everybody. Thanks for being here with Shannon and I today. I guess if you missed us the other days, I'm Andrea Leonard and this is Shannon Burrows. So
I'm still Shannon.
You're still Shannon. I'm still Andrea. And today we're going to talk about lymphedema, which, coming up in Breast Cancer Awareness Month is a really important topic to cover, although it is not only people who've had breast cancer that are affected. So I would go as far as to say that lymphedema is cancer's best kept secret. And I'm not going to tell you yet what it is. I'm going to give you a little background first. I've worked with cancer patients for the last 25 years and hundreds of them. I have trained thousands of fitness professionals around the world. And I mention that because, we have more of a pool to draw from, if you will, different cultures, different medical systems, different medical practices. And I would venture to say that at least 90% of cancer patients, all cancer patients, have never been told about lymphedema. So you're like, okay, Andrea, tell us, what is lymphedema? Lymphedema is the swelling that happens typically in a limb, but can absolutely happen anywhere in the torso, even into the facial area, when lymph nodes have been removed or irradiated with cancer treatment. Now, there are different types of lymphedema. I am only speaking about that related to cancer and cancer treatment. So what happens is the pathways become damaged and restricted, and the lymphatic fluid has a difficult time, if you will, flowing throughout the body in that impaired area. So I think the best way to think about it is like a freeway or a highway. And imagine that you've got 5 lanes of traffic, and every morning between, let's say, 7 and 9, there are a million cars that go through those 5 lanes of traffic. Well, what happens if one lane of traffic is shut down? There's going to be a little backup. Things are going to slow down. You may be on and off your brakes. But then what if there's 2 lanes of traffic? Then you may come to a halt, and it may be stop and start, stop and start. But if they shut down 3 lanes of traffic or 4 lanes of traffic, there's going to be a backup for miles. So if you can think about it in the same way and understand that the greater number of lymph nodes that are removed, or the more radiation, and that means the parameter, the amount of tissue that's irradiated, as well as the intensity. There are different intensities of external beam radiation. And then also the number of radiation sessions cumulatively over a lifetime in that particular part of the body. So when you think of each of those things and the potential for damage to the system, particularly in that area, I think it becomes easier to understand and visualize what I'm talking about. So it seems that this would be something that would be spoken about. And Shannon, whenever you're not answering questions or whatever, you can chime in to your own personal experience, because, one, I was too young to remember. And 2, I believe I have not had any lymph nodes removed, and I did not undergo external beam radiation. So it's a moot point. But I think that you can testify to what I'm speaking about.
So my experience with lymph node removal and lymphedema is my doctors didn't say anything to me about lymphedema at all. I was caught early stages, thankfully, but my oncotype score came back high, which is why I went with a double mastectomy. And with that came sentinel lymph node removal, and the hospital lost my lymph node. True story.
Attention all staff, we have a missing lymph node.
So I didn't find that out until the following week when I went for my checkup. And so I don't have any I had clear margins, but I have no definite, I don't have cancer anywhere else, but so far so good. But anyway, I was not told about lymphedema whatsoever. I do have that in the back of my head. So it is important that you ask what lymph nodes, how many lymph nodes were removed. It's extremely important when you're, doing the exercises with them. And ask if that lymph node, saved.
Well, yeah, and how many trainers, how many fitness professionals even knew about that? How many, we'd love to hear from you guys. 1, have you ever heard of lymphedema? And 2, if not, how many people that have you been working with who have had cancer that could potentially be, in this box, if you will? And I think it's greatly minimized when it is addressed. You probably won't get it, don't worry about it, yada, yada, yada. Even when people have initial swelling and they go to their doctor, they're told, sometimes patronizingly, honey, it's okay, it's a little swelling, it'll go away. You're smiling. Is somebody writing something? Shannon,
I think it's delayed. I was just watching. I keep going over the Facebook.
Okay,
Facebook's over
it's
here
all good.
for me
today. Face anymore. Little.
You're freezing or breaking up.
Okay, I had to move. It's the internet. So
Andrew's having internet connection issues.
I'm here. Here. it's saying unable to start video. So should I sign back or just?
Are you moving somewhere else in your house?
I moved somewhere else in my house. Can you hear me now?
I can hear you, yes, but it just says your name.
Okay, but if I sign out and sign back in, will it mess this all up? Because otherwise I can just talk. It won't let me. It says you can't start your video because the host has stopped it.
Aha, same thing that was happening to me when I signed on.
Hey, what would life be without some extra excitement? Just let me know what to do. I'm on standby.
You're not going to be the
I
host.
am the host. Yay, me! And you guys get a new background now. All right, so now we are in the living room. All right, so sorry about that, guys. The internet, I don't know. I don't know if it's because of all the smoke, if that can affect internet. We're in Portland, Oregon, and it's pretty bad out here. So anyway, let's get back to the stages of lymphedema. So stage 0 is considered latent. And essentially what that means is you're at risk for lymphedema. So anybody that's had lymph nodes removed or irradiated is stage 0. There's no visible signs. But what this tells us as fitness professionals is you need to incorporate lymphatic drainage exercises. You need to be very careful about starting and progressing slowly with anything involving that part of the body. So if it's okay with you guys, I'm just going to talk about as it would relate to breast cancer for the moment, just because it's easy to visualize. So Shannon mentioned she had a sentinel node biopsy. So you have a group of lymph nodes here called the axillary lymph nodes. And there are two potential titles, if you will, of the surgery for breast cancer. You have an axillary lymph node dissection, or you have a sentinel node biopsy. So a sentinel node biopsy is kind of the newer kid in town, although it's been around forever, but not as long as an axillary node dissection. They inject a blue dye directly into the tumor or tumor bed. And as that blue dye goes into the lymphatic system, the first lymph node to turn blue is considered the sentinel node. So that node is removed surgically and they send it off to pathology while the person is still, whatever you call it, sedated, unconscious, what have you, in the operating room. And if there is no cancer, then that's it, they're done. Okay, but if they find cancer in the sentinel node, then they usually will go in and take a larger sampling. So what did we just talk about? The greater the number of lymph nodes that were removed, the greater the risk of lymphedema. So essentially, Shannon's risk is half of what it would be had she had a full axillary lymph node dissection. And I'll get into the numbers in a minute, but just want to go through the stages. Okay, so stage 1 is considered pitting edema. And at this stage, if you were to take somebody's, in this case, arm, otherwise it could be anywhere in the body, and you were to press anywhere, it could be the hand, all the way up the arm. If it holds that indentation, that is considered pitting edema. Now, this is usually stage 1, but sometimes there is no actual pitting. So oftentimes that can be missed. Stage 1 is really important to identify because if we catch it, if we send our client or our patient to see their doctor or lymphatic therapist at that earliest stage, there's a very good chance that it can be entirely reversed. If it bypasses stage 1, or is ignored, then the next stage is stage 2, and that's where the tissue takes on a spongy consistency. So at this point, the tissue is full of fluid, it's heavy. Your client may be complaining at any stage of kind of pins and needles, tingling, numbness, warmth, heaviness. And what happens if it's not treated? Eventually the tissue can become hard and fibrotic, which we typically see in stage 3. But stage 2 is still treatable. It's just now they're probably going to be wearing a compression garment on that part of the body, which maintains the integrity of the skin, as well as, it's hard for me to describe it because I'm not a lymphatic therapist, but it's almost like a pumping sensation, which can work very well with exercise and the actual pumping of the muscles and the blood and the lymphatic fluid in combination. They'll also be going to congested or certified lymphatic therapist for treatment. And that is just one more thing that is a nuisance in this whole cancer journey. You know, first somebody's gone to all their radiation treatments 5 times a week for however many weeks. They've gone through chemotherapy for months. They've recovered from surgery. And now they are needlessly suffering with lymphedema, because more often than not, this could have been entirely prevented. And that's what really, I'm going to say, infuriates me, because it doesn't need to happen with proper education. So stage 3, now the tissue is hard and fibrotic. It is considered lymphatic elephantiasis. It is typically in long-term untreated lymphedema, and most often in the legs. There can be discoloration in the skin. The skin can even, you know, if you ever see a picture of a really bad lymphedema, it almost looks like on the feet there are barnacles, like you would see on the bottom of a boat. Very disfiguring, very painful. And think of how this is going to affect somebody's quality of life, their ability to perform activities of daily living, as well as do all of the things that they love to do. But you know, if it's in their feet, imagine how difficult it's going to be to even walk. So those are the different stages of lymphedema. Now, statistically, the numbers are something like 8%, 7 to 8% risk. And most of the research has been done on breast cancer. There is not a whole lot of information out there, in particular about lower extremity lymphedema, you know, probably because the most funding is in breast cancer. I don't know. But in any case, so a roughly 8% with a sentinel node biopsy, and then that doubles with an axillary lymph node dissection where they're taking a large cluster of lymph nodes. Add radiation, external beam radiation, to either of those, and it doubles again. So, you know, sentinel node and radiation would be roughly 15%, and axillary node dissection and radiation would be roughly 30%. Coupled with that, if somebody has a high percentage of body fat, because the adipose tissue retains fluid and also interferes with the flow of lymph, aging, just the natural process, your immune system doesn't work as efficiently as you age. If they have poor nutrition, these are all additional factors that can increase somebody's risk who is already at risk. So just because you're old, just because you're overweight, or have poor nutrition doesn't mean you're going to get lymphedema spontaneously, but in addition to lymph node removal or radiation. So think about that when you are deciding what exercises somebody should do, knowing either that they're at a risk for lymphedema or they have it. Where do you start? And how can you ensure that you're not going to choose a certain type or intensity level of exercise that is going to either cause lymphedema or worsen the swelling? So if anybody out there in TV land has experience working in this scenario, we would love to hear from you. You know, what have you done? And I'm not going to tell you did it right or you did it wrong, but I would just love to hear what you've done in this given situation, if you even knew to make any modifications. I think of little red flags going up. So when I'm looking through somebody's health history, first off, I ask questions. You know, they might say, I had cancer. Well, that's a pretty general term for over 200 different diseases that are called cancer. So cancer is not enough. What type of cancer did you have? And if you don't want to ask what type of cancer did you have, what surgery, what treatment, and when was it? Because these are all factors that you must know when you are prescribing exercise. Now, this would certainly be called medical fitness. You know, the whole concept of exercise as medicine. And while we are not medical practitioners, unless you happen to be a doctor, a nurse, a physical therapist, occupational therapist, we are bridging that gap. We are working together collaboratively with the medical profession for the benefit of the patient, but also think about this. Think about how it benefits the medical practitioners in multiple ways. You know, they have to crank out X number of patients every day to meet their bottom line, whatever that is. And so it's boom, boom, boom. We've all been, you know, in those offices where you just feel like cattle going in and out. Now, I know like Shannon loves her doctor and has a wonderful relationship. And hopefully we've all experienced that as well. But generally speaking, there's not a lot of time for schmoozing or even learning about what's going on with your own body. So we have the opportunity to position ourselves, fill a need with the medical provider, to allow them to perhaps offer additional services that benefit their patients, but also create a revenue stream. Because especially with COVID and everything that it's done to the world at large, to be able to offer additional services for their patients is a very appealing opportunity for most medical providers. And Shannon's going to talk to you a lot over the next 2 days about business building and opportunities and that type of thing. So I'm not going to get too deeply into it, but I just wanted to present that to you. Lymphedema training is one area in particular, to be able to evaluate people and give them specific exercise programming that will hopefully prevent lymphedema and absolutely minimize it if in fact there is any noticeable swelling. Because honestly, the doctors, you go to the doctor, if they recognize it, if they acknowledge it, they're going to send you to therapy. So, and then you get done with therapy and they're going to circle back to the cancer exercise specialist. Whichever direction it goes, it would just be easier if the flow were smooth, both in the lymphatic system and in the medical system. So exercise programming. Can I take a breath for a second, Shannon? I'm talking like really, really, really fast. Anybody have any input, or do we have a quiet audience today?
We have a quiet audience today.
It's because it's hump day.
Because it's hump day, and they were so excited to hear about lymphedema today. So I think they're just probably taking in all of the info.
Yeah, absolutely. Well, so it's going back to the medical history and asking the appropriate questions. So not only, okay, what type of cancer did you have? What surgery did you have? When did you have that? We want to know, if they are completely healed and ready to begin doing certain exercises. And that includes a lymph node dissection as well as treatment. When did it end? When was the surgery done? We need to allow a long enough healing time so that there are no risks there, because internal healing is going on as well as what we see externally. And then if they tell you they had radiation, then the next question is where? Because unless they've had full body radiation, perhaps prior to or after a bone marrow transplant, or they have lymphoma and they've had lymph nodes irradiated throughout their body, generally speaking, it's going to be one localized area. And the reason for that is it minimizes damage to the surrounding tissue. And that's the goal of radiation, because it's a localized treatment versus systemic, there's less damage. So once we have all this dialed in, then we have to come up with a plan. And that plan must include lymphatic drainage exercises. So there is a method to this madness from the very beginning. When they start with their cardiovascular exercise, there's a certain intensity that they need to be exercising at. So we can affect frequency, intensity, and duration, right? And all of those things are modifiable, but we have to start at the lowest common denominator and gradually work our way up. Because if we do too much, too fast, then we run the risk of actually spurring lymphedema on, or of making it worse. And so what happens is, I think that a lot of fitness professionals get gung-ho. Yeah, let's do this, go, one more rep. And what they don't realize is that last rah, or that extra minute, that extra pound could be the difference between getting lymphedema or not getting lymphedema. And that may be the biggest bone of contention that I have, because, not getting the education that you need is the easy way out, and it's harmful to your clients. So we're talking about lymphedema today. We talked about cancer treatment yesterday. We talked about surgery the day before. What happens when you have all three? So you're not just dealing with one thing. You have to go through, you have to understand the acute and chronic side effects of the surgeries that they went through. Then you have to take into consideration the acute and chronic side effects of their treatments. And then we add on whether or not they're at risk for lymphedema, and that completely changes the workout, because this person can basically do whatever they want on the unaffected part of their body. So if Shannon's at risk in her right arm, I'm not going to just work her left arm, because then we're going to have an imbalance. The left arm will continue to get stronger while the right side atrophies. You know, that's a whole other ball of wax. But lower body, she is not going to get lymphedema, unless, of course, she had also had lymph nodes removed or irradiated. So Shannon can do lower body she can do walking lunges from Florida to Seattle if she wants. You ready to sign up for that?
That was cute butt and legs.
I mean, you'd be rocking by the time you got there. And then if somebody's at risk for lower body lymphedema, they can do upper body stuff all day long. However, you still have to keep in mind that because we're looking at a system, much like the circulatory system goes throughout the body, so does the lymphatic system. So we can't selectively increase body temperature in one part of the body. We can't keep it to just the lower body. We can't keep it to just the upper body. So anytime somebody works out at a high intensity and you've got more circulation, more blood flow, more lymphatic flow, it's a double-edged sword, because the body heats up, which can increase the risk, but also you have more fluid circulating, pumping through the body, and now you've got this damaged system that can't actually handle it. So, I can't teach you everything you need to know in this session today. There's just too much. It's an entire chapter in our course. But what I can tell you is that if you don't understand the elements that I'm speaking of, you are potentially putting your client at risk. You need to understand all of the ins and outs of everything we've talked about for the last couple of days and then today, to be able to safely and effectively put together an exercise program.
We have a question.
Good.
Terry says, are clients always at risk of lymphedema even years after treatment, or does this risk decrease over time?
Terry, I love that question, and I'm so glad you said it, because that's usually in my repertoire, but for some reason it kind of just went today. So the answer is the risk is at its peak at about the 2-year point, where scar tissue and adhesions seem to build up. That's their tipping point, if you will. Much of it can be reduced if somebody sees a therapist who can actually break down a lot of the scar tissue and particularly adhesions, which are like thick layers of collagen that bind down, which limit range of motion. They can affect posture and obviously affect lymphatic flow. So that's the peak risk. However, that risk does not go away. There, once again, is not a lot of research being done, little bits and pieces here and there, showing that maybe the risk diminishes over time, but then somebody else comes back and says, but as you age, your immune system is compromised. And so what does your lymphatic system do? It defends your body against infection and other harmful agents as part of the immune system. So that's the long answer. The short answer is yes, you have to worry about it forever, which means that whoever this person is should be doing the simple act of spending 5 or 10 minutes doing lymphatic drainage exercises. It's not a big deal in the grand scheme of things. And as a fitness professional, you should be starting off taking baseline measurements of that particular area, so that, if the client complains that their arm is heavy, their leg is heavy, swollen, whatever, you can go back and remeasure and actually see if the girth has increased, but also be teaching them about, doing pitting and education. My God, this is such a huge opportunity for you to get out there in your community, particularly in cancer support groups and medical practices, and talk about lymphedema. Give them information on ways to prevent lymphedema. We have a whole sheet of different ways to prevent lymphedema that I encourage everybody to share and, get out there and talk to as many people that have been affected as possible, because the reality is they probably do not know. And they are more than likely doing something or many things throughout the day that can elevate that risk. So there's my answer. Thank you for asking that question, though. Appreciate the participation.
Always a good question.
No, it is, and that is also something that is kind of the great unknown for a lot of people. I'm sure that if you talk to the people who are at risk for lymphedema, many of them are under the impression that they're no longer at risk because so much time has passed. And it may be the simple act of a bug bite, a bee sting, or even getting nicked at the nail salon that causes the response. What happens is, you've got these little fighter pilots, if you will, your lymphatic fighter pilots that are on standby to protect your body. So anytime there's an infection or a potential for infection, you've got all these fighter pilots going zoom right to the source. So if it were a bug bite, a bee sting, a burn, that's where all the lymphatic fluid is going to fight off that potential infection. And then if there is a backup, if there is damage to that area, they potentially get stuck there. So that's my silly little, I always get confused between metaphors and analogies, but it's one of those. My husband said it's an analogy. Don't ask me what a metaphor is then. Like or as, or simile is like or at, whatever. I give up.
It's not your forte.
It is not. I'm a fitness person. Ask me anything about cancer or fitness, we're good. Ask me about the English language, we may be in trouble. What's the word? What's the term for like RAIN or REIGN?
Rain.
Like rain, or the book. What's the book? No, Onomatopoeia. No, I don't think. Anyway, we're totally going off sidetracking now. There's a book.
Confirm body composition and a high body fat affect lymphedema risk and management.
Asking that question.
Debbie is, yeah.
That is what I have always been told. And the simple answer is that adipose tissue, fatty tissue. I mean, you've seen, here's what 5 pounds of fat looks like. It's like honeycomb. It retains fluid, and it can also interfere with the pathways. So therefore, losing weight becomes a pretty important thing, or losing body fat, where, like I said yesterday or the day before, it's not about fitting into a size whatever. It's not about looking a certain way. I mean, for a lot of people it is, but more importantly, there are health reasons. Lymphedema is one, as well as an increased risk of heart disease, future cancers, and diabetes. So really important that we are referring to a registered dietitian, nutritionist who specializes in oncology, not just general food guidelines. That's not going to cut it in this case.
That answers your question, Debbie. Has anybody worked with, I'm asking this question for the people to respond. Has anybody worked with anybody that has lymphedema or has had lymphedema? Comment below, please.
Yeah. Oh, I want to tell you something else while they're commenting, Shannon. I remember a client that I used to work with who she had breast cancer and she had lymphedema in her arm and was always wearing a compression sleeve. So she had active lymphedema. And I remember like noticing that her sleeve was wet. And what happens is when the swelling is so bad, they get what's called weeping, because the limb is so full of fluid, there's nowhere for it to go, and it actually starts coming out of the pores in later stages of lymphedema. Well, food for thought there.
Speaking of sleeves, I want to piggyback on that for a second. If you do have a client that has a sleeve, they do need to wear it in order to work out with you.
Yes, if it's been prescribed, and they have told you that, because it's been medically prescribed, which means if you allow them to exercise when they forgot it, you're putting yourself at risk. You're definitely putting the client at risk, and because of that, you are stepping into legal waters that you really don't want to have to tread on. It would be like your diabetic client forgot their insulin and forgot their blood sugar monitor, and you're like, no big deal, let's just do a little workout, where they could potentially, have some serious repercussions from that. My husband said that the term I was looking for is homonym, something that sounds like homonym, but different words. It's spelled HOMO, the same. So like rain coming from the sky, or a king reigns the kingdom. I was talking to Ayla about that yesterday. There's a little kid's book called The King Who Reigned. It's fabulous. Like chocolate mousse, MOUSSE versus mousse.
Glad we got that covered.
You know, guys, we have to add some fun here because otherwise you're never going to get through working with cancer patients. I'm not saying make fun. I'm saying have fun. So if nobody has any questions, that's pretty much it in a nutshell. You know,
Tomorrow we're going to cover
all my
your,
favorites.
yes, tomorrow we're going to cover creating a niche for your business. So now what happens if you decide that you're going to go through and become a cancer exercise specialist, then what?
Yeah. How do you get clients? How do you position yourself as the next step in the healthcare continuum? And I was just texting a friend of mine who works for the National Academy of Sports Medicine, and you know, we've been talking, gosh, for almost 20 years. We've been collaborating and what have you, and it just made me think about just the system as a whole. You know, we go, whether you're Yoga Alliance or Pilates Method Alliance or NASM, ACSM, ACE, whatever, year after year, you know, we take these certifications and then we have to pay for renewals. And oftentimes we're like, I don't have any clients, or what am I doing now? And so two things that are I think, really valuable that we offer. One, you may not like this part, is we update our materials every 2 years. So you must retest every 2 years on the most current information available. No one in the industry is doing this, and that is a problem, because as cancer treatments, as surgeries and everything evolve and change, if you are still stuck in 2010 with your knowledge, then you are doing your clients a major disservice and you're putting yourself at risk. So throughout the world, people know, medical professionals, that the standards for CETI are the highest in the industry, which means you are more likely to get hired or get referrals. So, you know, that is really important. And then the other part is, we don't just leave you high and dry once you complete your certification. We have a mastermind group. We have business building. Even marketing is part of your course in module 4. We add you to our cancer exercise specialist directory. You also get added to the American College of Sports Medicine's Moving Through Cancer directory. So we are creating visibility. We want you out there. We want you helping cancer patients. So if they don't know where to find you, that doesn't do them any good. And I think these are really important factors when you're choosing a certification, when you're choosing to spend time and money in your education.
Terry said that she had a client come in for her PT session with a swollen red hot arm from canola from her chemo. She got sent straight to the doctor and ended up on IV antibiotics for 24 hours, and she has no idea what it was.
And I don't know if that's lymphedema or not. As I mentioned yesterday, chemotherapy can be a contributing factor to lymphedema. Highly unlikely that chemo alone will cause lymphedema, but there is a connection. She may have, obviously she had an infection. An infection doesn't always lead to lymphedema, but it can certainly increase the risks. So hopefully for her, the antibiotics worked and nipped it in the bud, and that is not something she has to worry about. But what I would say, Terry, is that if that arm that was swollen, if she had breast cancer, and that is what we call the affected side, I would be very leery and be aware, hyper aware of any swelling. And besides the fact, just the fact that she had lymph nodes removed or irradiated on that arm, you should absolutely be performing lymphatic drainage exercises and making sure that you are going incrementally in upper body strength training, any type of weight bearing, repetitions. All of these factors need to be modified. And so when and if she comes back, or already has, you're kind of going back to square one and slowly building up, because, and I don't think this is the case with what you're talking about. It sounds like just kind of an anomaly, but if, for example, the swelling came about after a workout session, then you probably did too much. And Terry, I am not putting the blame on you for this. I'm sure it had nothing to do with it. I'm simply saying, as a fitness professional, we need to be aware of that, because they should not have swelling after a properly executed exercise session.
She is correcting herself, saying that it was lymphedema, but she, the patient, the client, had no idea anything about lymphedema, is what she was trying to correct that.
Okay. Case in point. Case in point. And to get that bad, ugh, hopefully she's on the road to recovery. And then, Terry, now it's your time to understand the whole the whole progression and how you can, if she comes back to you, how to safely reincorporate exercises, because you're starting from square one now, wherever she may have been before. And make sure you get a medical clearance from her saying that, yes, she has lymphedema, and she needs to, if there are or are not any precautions or modifications, and if she's been given a compression garment, she needs to wear it.
Anybody else have any other questions before we wrap up for today? It's a lot of stuff to process the last 3 days. We've gone through the cancer surgeries, the cancer treatments,
Yeah.
lymphedema.
We went through about 200 pages of material.
Yeah, and then what do you do? So a lot of things to factor in. There's a lot of things to factor in when it comes to exercise programming in regards to the surgeries, the treatments, and lymphedema, which is why it's extremely important to make sure that you can gather all the information you possibly can and become certified as a cancer exercise specialist, because you don't want to do any harm to yourself or your client.
You know what I'll do, Shannon? When we hang up, I will post the curriculum for the coursework, just so people can get an idea how comprehensive it is. And that way you can kind of say to yourself, okay, I'm doing this, oh, forgot about, no, not doing this, and get an idea of just how much you really have to know to be a true cancer exercise specialist.
Let me show them the books.
Oh, there you go. See, I don't even have a set.
I do.
Pretty. You and the books are kind of fading away into your green screen.
Do you see them?
They're very shiny, yes.
I like shiny things.
That's about 500 pages. I know, I like shiny too. Do you see my bling? Bling, 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 bling.
It's a fun side.
There's about 500 pages of material in there. And then there's also videos and webinars. And I feel like I'm on a webinar constantly these days, but you have constant support. And the cancer exercise specialist group, oh my God, I can't say enough. In fact, I think I was talking to my husband last night, talking to somebody, about how even I get support, moral support, work support, client support in this group of certified cancer exercise specialists. I mean, it is amazing how everybody.
Oh, family.
It is a family. One of our own had a mastectomy yesterday. And everybody, she's talking about it, and everybody's there supporting her and sending prayers and all that good stuff. I mean, that's not the intent of the group, but that is a part of it too. It's really quite amazing.
And just so you know, the Cancer Exercise Specialist course is online. You have your own portal. Everything is put into there. And if you would like to order the hardcover books, you can, but you don't have to if you're one of those people that just like to have everything digital. So
hey, I like a highlighter.
I know, and post-it notes, color.
Exactly. But yeah, lots and lots of resources. You can check it out at CETI, which is the acronym for Cancer Exercise Training Institute, ceti.teachable.com. If you just want to see what it looks like and that type of thing. But I'm going to post the curriculum, like I said, just to make it easy for everybody. And then Shannon, you'll talk more about everything tomorrow, and I'll rejoin you on Friday and talk more about all of the good opportunities.
Perfect. All right, friends, thank you so much for joining us. If you don't have any other questions, we're going to sign off. If you do, please holler now, or go ahead and leave them in the comments, and this will get back to you. Hopefully that this has been a lot of good information for you, and it is intriguing to you, and you are saying to yourself, oh my gosh, I really want to work with this population. They really need us right now, and you are interested in doing your certification with us, because we'd love to have you join us.
And we would, but on the flip side, we're also happy if you say to yourself, you know what, I'm doing a really good job. I've dotted my I's, I've crossed my T's. I am not putting my client in harm's way. That makes me happy too.
Yes. Heart happy.
Heart happy. All right, we'll see you. Well, I won't see you. I'm going to be on a plane out of the fiery blazes of Portland tomorrow. Unfortunately, the only flight I could get was at the time of the webinar. So I will join you guys on Friday, and you will be in good hands with Shannon.
Yes. All right. Have a great day, everyone.
Bye.